inconvenience.
Yeah, the presentation is there now.
Okay, okay. Thank you so much for the inconvenience. First of all, organizers to give me this opportunity to share my experience. Abuduxike, I'm working in university in Faculty of Medicine. With you today, one of our that we have done like years ago regarding health-seeking behaviors. We have done this among who came to these sectors in northern Cyprus. Next, please. So in this presentation, about some background objectives that we use in this study and some results and I would like to mention some study and with some recommendations. Next, please. Okay. So in 2019, we had this kind of vision. Everyone, anywhere should, which actually supports to health coverage in all countries. But in reality, it's not the case. In universal health coverage, countries should have efficient primary healthcare services at first. Also, along the way, people should actually use healthcare that is provided. When we talk about next, when we talk about efficient healthcare utilization, actually lots of factors in a country, some of the country, and the healthcare services distributed to the population and seeking behaviors of the population. So this is determined by lots of factors, social demographics of the population, economic factors, cultural, gender norms, factors actually all together will affect peers. Please next. So here in the study, we health-seeking behaviors of people to give you some background about this. So this located in Mediterranean and it has hot weather most of the it's closely bordered with Turkey and Israel, so you can actually imagine this island. And so now the study was colored region of it. It's 1/3 of the total population, including foreigners. It was like 335 in the GDP is not for a developing country. They're actually quite high, and it's Sweden, and this is actually mainly diet and the high inflation. However, we would like to study healthcare system, how it works in Northern Cyprus. Can we please go next? Okay, I would like to give you some how to say overview of Northern Cyprus. Developing country, so it has a very small, consider that, and it has like around healthcare facilities are public, 14 are actually private, including healthcare centers. But in considering other, you will see Can you please? So there is no established primary healthcare system in Cyprus. So people can just go to the specialists when they wanted for small health to the specialist. And the healthcare system, it's not distributed equally. So if you go to a crowded district, or you will find lots of health facilities, while not that much. And there is no official report about the healthcare system, how it came place suppressed, and also these gaps. Can we please go next? Due to all these gap and also this kind of lack of studies on this area, because the determining factors that influence the usage among outpatient visitors in selected. And by doing that, we try to fill the information in examining this healthcare behaviors of island. So please next. So in this study, we cross-sectional study design, and this study was between September and October in 2018. These two health facilities, because public and another was private, to get access to, because we had some agreement with the Ministry of Health, so it was easier to conduct the research. That's why we facilities. And the sample size we calculate based on population, the minimum 71, and we recruited using a convenient sampling method, using a structured interview where administrated 35 questions and relevant questions regarding this health status and all others. In this study, the main outcome was healthcare seeking defined as the willingness of an individual when ill, and also where a sick person, among others. So we used for estimate healthcare seeking behaviors, which was refusal of seeking, and preferences of public and private health center, each one of them, and admit feeling sick. So as the result, next please. So our participants were age group, mainly the mean age was with the standard deviation of 17, and more than half of them were women, and of them reported to visit health centers problems. Next, please. Actually had a routine medical checkup during, and 12.2% of them had while feel sick, and about them reported to actually prefer public health or private. So we ran this, so we can see that from apart disease status, all other social shown statistically significant difference. For those who actually visited Caribbean, they were like more older age group, more bridge, and also they had higher. Next, please. Mostly look at the characteristics of the part 2 health facilities, those who visit private health facilities were more older age, education, economic status, and income level, had private insurance, and also take lots of characteristics of the come to Cyprus after they retire. Is primary care system in Britain, so as you go to this hospital to best service, and also clinic doctors can speak English so here, which they will have is. So if you look at the people who facilities, they had bigger families than 3 children, and also more public health facilities because more smokers here in this. So we also analyze the characteristics of these participants who do routine checkups are like females, more age group, and those who have chronic, and those who have poor health perception checkups more often, and those who refuse to go to the hospital were younger people with low education, were Turkish, and also had good health perception, so they actually somehow ignore. This is one of the assumptions that we had. For public health centers overpriced more than the British. They had low education level, characteristics of people who actually public sector over private. The health center, while they are sick, the characteristics are similar to those people, private health centers like the foreigners. Also ran a logistic regression model to factors associated with this visiting while they're sick or doing routine check. As you can see from the table, there is indicator for visit health problem, like those people who when they had higher education level. So if someone has education level, they are 2 times more likely to, while economic status and also several the preventing factors from visiting a health center. So it's determining factors for checkup. People who are working are not actually doing the checkup. Due to routine medical checkup, so they don't go to the health center. One of the reasons, and also those people with chronic diseases, they are 2 times checkups compared to others, and one of the preventing factors actually is. So we also found that having those people are 2 times more likely in checkups, just like the people who have and less than 500. So they have this public hospitals to public facility to actually covered by the government and also subsidized some kind of determinant factor for that also. Next, please. As a summary, this study shows evident disparities in the socio-economic status of these 2 different health facilities. These are lots of studies done in developing and also. So health-seeking behaviors related to the factors like income, insurance status, chronic illness status, and out-of-pocket ability, and also family size. So needing chronic diseases and having poor health are the main determining factors, predisposing factors. Next, please. From the study findings, we actually found the government should actually conduct a lecture regarding this topic to come up with to ensure the effective utilization and the resources, as it's not really that much, so they can actually efficiently deliver health services. Next, please. So I would like to guide some strength of the study. This is the first OC conducted on this topic, which a snapshot on this topic, and also on the utilization behaviors and also here. So this is kind of filling the information. We have so many limitations as well. To be noted, design is cross-sectional and also using will reduce the representativeness and reliability. The questionnaire that we use actually depend on the reference. So this is kind of actually source for information, which reduce the internal validity of the study. And also we could use any objectives such as number of outpatient visits, expenditure of healthcare to find to analyze this. Why these limitations of our study that I next, please. Okay, that was the end of my presentation about our published in 2019 Journal of and those were the I would like you to actually Sungul and Shanda, I would like to mention them, and this was journal to be actually publish a paper. So this is the end of my presentation. Thank you so much for listening.
Thank you so much for the excellent presentation. Members, do you have any?